Dr. Rapaport, good morning.
Good morning, John. And before you delve into questioning, I must tell the audience that you're very special, that you are almost near cure, and your questioning is superb. You bring out the best answers in me.
Well, don't tell anybody, but me having these conversations with you is a very deep act of selfishness on my part, because I'm one of those people that need, I think maybe as we all do, that repetition, and it's very, very helpful.
Well, you bring up a point before you ask a question. When something takes a very long period of time in medicine, and there's so many days involved, there are huge variations that can occur, and everybody acts differently. So when somebody comes up with a comment, oh, this is meaningful, this is not meaningful, et cetera, they don't know what they're talking about because they haven't lived with thousands of patients who have gone through 3,000, 4,000 days of suffering. Every day is different. Every day is different.
Well, and I noticed, and I did want to do some housekeeping things. First of all, I would like to congratulate you on your film Skin on Fire being honored at the Ethos Impact Awards last Sunday. That's a big deal.
James Keach, superb director, producer, and he won the award for our lifetime achievement. And thank you. I hope everybody watches it and they get a lot out of it.
Well, I think the untold story on that film is that film wouldn't have been possible if for not you, I don't have a better word than badgering James Keach, but you certainly brought it up and coordinated to come up with a format that makes it engaging and important for people who were suffering from this situation. You're the impetus behind the film.
Well, I guess I'm like a dog with a bone. I will not give up until I solve this problem. There are too many people suffering, and I've been the repository for their woes and suffering and misery and depression and suicidal ideations, and I will not let that happen to a group of patients, people who are not ill. They're just miserable.
Are you still, I shouldn't say still, are you consulting patients individually? Are they available to communicate with you directly?
I've been continuing with the telemedicine, and probably over 1,000 patients I've seen in the last 13, 14 years via telemedicine. There are 4 new patients who just came on board last week.
How does someone get a hold of you for this type of thing?
Well, they look up my internet. My email address is on there. My telephone is there.
You're on Facebook as well?
Yeah, and Facebook.
Just Dr. Marvin Rapaport?
Yeah.
Okay.
And Red Skin Syndrome, and I should think I'm all over the place. They just get in touch with me, and I answer that same day, and I bring them on board and try to solve the problem as quickly as I can, but it takes a long time.
Well, and I don't want to gloss over that, because that's something I think we continually are going to hit upon, but this definition of telemedicine, in addition to just holding their hand, are you also willing to coordinate with their dermatologist or their general practitioner to establish a course of symptom management, I guess? Is that something you do?
Absolutely. My attitude has been, I want you to function, Mr., Mrs. You cannot mope around the house or be suicidal. I will not allow that to happen. And there are ways of handling it. There are medications we have that stop the itching, that stop the burning, that help you sleep, et cetera, et cetera. There are bigger guns, and the only big gun that I have found to be almost near perfect, side effect minimal, is cyclosporin. All of the other new drugs, Dupixent especially, have failed and failed and failed. In fact, I saw on telemedicine last night somebody from California. We talked on the phone. I like the first visit to be a telephone conversation. And she said that the last of the 4 dermatologists that she went to said that she should be on Dupixent for the rest. She's going to need to be on Dupixent for the rest of her life. Well, that's a hell of an annuity to tell patients that you're going to need drug if you're the drug company at $60,000 a year. Wow. And it's totally inappropriate and poor medicine, and the drug has failed, in my experience, well over 600 times.
Well, see, I think about it a little differently. I think what's happening is drugs like Dupixent are getting the benefit by default of your work. And let me explain. The person goes on one of these therapies, Dupixent, they go off topical steroids, they go through withdrawal, they're continuing to take Dupixent, and they have clear skin. See, it's working.
Absolutely logically illogical. You have 2 factors going: cessation of steroids and Dupixent and drug. And they're giving credit to the drug when you're right. The reason they're better is off steroids, no steroids. Period. That's the answer. They're addicted. If you go on an anti-tranquilizer while you stopped your opioids or your amphetamines, and you say, "Oh, I'm so much better because of this new tranquilizer I'm on." No, you stop the opioids. That's why you're getting better and better and better. But it still takes a long time. And they're giving credit where credit is not due. In fact, there were 2 patients recently. I held their hand, 2 men in fact. I held their hand for 3 years on cyclosporin, miserable for 3 years, but they functioned. There were weekly, monthly comments back and forth, more hand holding, more phone calls. And they drifted away, and they got much, much better in the 3rd year. And they drifted away to other parts of the country or whatever. And they went to other doctors, and they went on Dupixent in the 4th year. And they wrote to me sort of sarcastically, "See, I was cured with Dupixent." Well, we did the heavy lifting for 3 years with cyclosporin, and they're giving credit to this newcomer on the block that is charging a fortune, is being charged a fortune for, and it does not cure anybody.
As a standalone therapy.
Period.
Yeah, right.
Period.
It kind of reminds me of the old saw about the guy walking through Central Park blowing the whistle. And they say to him, "Why are you blowing this whistle?" And he says, "Well, to keep the elephants away." And he says, that doesn't seem logical. The guy says, "You don't see any elephants, do you?"
And you're right. We can make up all kinds of quips and get people's attention with them, which you do well. Sorry, but it's sad. It's so sad. And when you have an expert at some university who studied the drug and got paid very highly for the usage of these patients, I won't use the word guinea pig, but as a subject, and then they tout the drug as being so good, and they give lectures about the drug, and everybody who comes to that university gets put on that drug, and I see them 6 months later as failures, and they come to me, and I put them on cyclosporin, and within days, they're markedly better.
That brings up a thought about, I think generally the online information about red skin syndrome and topical steroid withdrawal. People do the research and realize they have to go off their topical steroids, and then that's it. Then they're miserable for a period of time, not understanding that there are things that can help them. What is your message to those people that are wanting to do it just cold turkey?
I would love to have a bullhorn and go out there and say, find a caring doctor, find a caring internist or GP who will hold your hand and get you the right medication. Tell him or her to call me. I'll be glad to impart all the knowledge I have that will help you. Get help. Don't hide in the corner. Don't listen to, a patient commenting on their Facebook or on an email of that vitamin B12 helped them, or that standing upside down with an acupuncturist helped them. These are faulty bits of advice. There are very, very sound medical things that will help you and get you through this.
Get them through it. It's interesting. One of the comments we had was how, people don't necessarily take this whole notion seriously. The whole notion of topical steroid and red skin syndrome. If they're not taking you seriously, and I use they and as far as kind of the medical orthodoxy, that patient going to the doctor who explains this and the doctor rolls their eyes. What do we do about that?
It's very difficult. I have heard the word via the emails I get and questions I get. I've heard the word gaslight. Gaslight comes from a movie with Charles Boyer and Ingrid Bergman in the 40s, where he was the husband of this very well-to-do woman in Victorian England and wanted the house and was trying to make her believe that she's crazy. And the movie was called Gaslight. And this is what the patients now, the young people, are saying they're getting from their doctors. They're getting gaslight, and they're getting from, it's usually the young women who are getting gaslit by their newfound boyfriend. They lie to them. They roll their eyes at them. They think that they're stupid. They think they're neurotic, et cetera, et cetera, et cetera. And they're not caring of these poor, suffering patients, the doctors. And the patients are just absolutely turned off from the edict of years ago that the doctor was sacrosanct, his knowledge was perfect, and he's there to help you.
Yeah, Vicky wrote, if your big voice is falling on deaf ears, you can imagine what they say to us. We are not peers, and they gaslight us.
Yeah. It's the comments, the replies. I've seen that and over again. And that word has infiltrated the vocabulary, and it's beautiful, and it's appropriate.
Well,
sorry.
No, it's a great point. The other thing I would like to bring up is that you continually repeat 3 to 5 years on a journey to be off of or be through with topical steroid withdrawal. There's a sense out there that if at 6 years someone has a flare, you're wrong and everything you've said is wrong, and the baby gets thrown out with the bathwater.
Well, very interesting. That's why medicine is so much fun and so exciting. So 30 years ago, I used to say 1 to 2 years because most of them were addicted to weak to moderate strength steroids. And it took 1 to 2 years only. Then when the super potent steroids came out and I was seeing more and more patients, I started saying 3 to 4 years. And now I'm saying 3 to 5 years. And in fact, I've said maybe 3 to 5 years plus a little bit more.
Yeah.
And I'm talking about cure. No rash, no creams, no doctors. They're perfectly fine. What also is coming up in the questions after our interviews and other areas, the patients say, I still have TSW, I'm in TSW at 7 years. No, whoa. The red skin syndrome, the redness, the addiction part, the withdrawal is over in 3 to 4 or 5 years plus a little. No redness, no sleeplessness, no horrible itching, no burning, etc., etc. Those who say they're still in withdrawal have thick skin from years of scratching. It's elephant skin. It's not red skin syndrome anymore. The acute phase of this problem is gone. They're scarred, if you may. And time and sunshine will make that elephant skin go away. They do not have red skin syndrome anymore, and they're not in withdrawal anymore. Their redness is over with.
That's very helpful. I also saw a question. This person says, how is it that I had clear and good skin during months 5, 6, 7, and 8 of withdrawal, and then in month 9, everything went bad again?
As I said, medicine is fun because it's replete with variations, and to be a appropriate, knowledgeable doctor, you have to see many, many patients, and you get a potpourri of variations, and you understand the disease. We've seen all the patterns in COVID. Patients are accepting that. They saw all variations in the 3 years that we've been all suffering. Some have nothing. Some have a positive test. Some are sicker than hell. Some die. Well, it's the same virus. Well, the same with this situation. The vast majority have a pattern. And the pattern is there's a honeymoon once they stop steroids for probably a month, 4 weeks, 6 weeks, where they feel pretty good. Oh, this is going to be a piece of cake. Then they flare. That's the typical for almost all of the patients. Then they go through suffering. They're miserable. They can't sleep. They're red. They're itchy. They're swollen. They're oozing. And if they get some drugs to help, medications to help, it's eased a little, but they still have the redness. And then they'll have a little bit of a honeymoon again. They're getting better, maybe at the 9th month, as this last patient cites. And then they flare again. And the typical story for the 3 to 5 years is flaring and calming down, longer good times, shorter bad times. And that's the typical. And you're right, patients are like to hold a gun to your head. You said, and I was off by a week. How dare you say that with impunity? Well, give me a break. There are variations in a thing that takes 3 to 5 years, by a week, by a month, by 2 months. But the pattern is usually so typical in everybody.
Well, and that brings up a point. People who have gone through the process have a flare, go to their dermatologist, and they want to do a biopsy. And the question is, does a biopsy indicate either atopic dermatitis or an addiction to topical steroids?
Well, going back to the very first part of your question, the unknowledgeable doc who has had little experience and worries. So if you don't get better quickly, and he has no knowledge of what the disease pattern is, and he thinks it's bad eczema, starts thinking the worst. Maybe this patient has lymphoma. I better do a biopsy because lymphoma can be red skin syndrome. Very, 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 very rare. Maybe it's some kind of photo problem from the sun, maybe lupus. We better do more blood tests. We better spin them down in the centrifuge. Let's look for the hidden allergen, et cetera, et cetera. Because they panic, the doctors. They don't realize that the patients are not sick. They're just miserable. Also, the biopsy I've seen in one of the replies on in our discussions, that the doctor said, oh, you have down deep in the biopsy, you have deep atopic dermatitis still. No. You have stopped having atopic dermatitis. You are addicted to steroids. It's an entirely different diagnosis. Yes, you have the inheritance of atopic dermatitis, and maybe you're a little itchier than the other people in your family, and that's part of the inheritance, but you don't have the typical eczema in the crook of the arms, behind the knees, the slobber dermatitis of infancy. You will never have that ever again. And he's wrong. He or she is wrong. You do not have atopic dermatitis. Well, no, you won't manifest it anymore. You are only manifesting this other disease. And that's why Dupixent doesn't work, because it is not atopic dermatitis. There are other diagnoses who chronically use steroids. Psoriasis, seborrheic dermatitis of the face, photo problems, sunlight problems, chronic itching in the aged skin, older people, and there are a couple of rare things. Pruritus, itching in the vulvar area in women, red scrotal syndrome in the men who have dryness and itchiness after putting steroids on during the summer after a sweating episode, after they exercise, and they get addicted to steroids. Those patients chronically use steroids, and they look exactly the same as the atopic dermatitis patient. Period. It's the chronic usage of steroids, and it's called TSA, Topical Steroid Addiction.
So that person that is suffering from all those things that you just described and is going or has gone through the journey, do you have a feeling about daily moisturizing and moisturizing withdrawal and those things, or is that something that you comment on?
Well, you have to have the pathology explained. Most patients have no idea. They see the scaliness, the dryness, the itchiness, and they've been sold a bill of goods about lubrication, or no lubrication, or let's attack lubrication, or I got a new high-price spread lubrication that you should buy, etc. So this is a vascular problem. It has nothing to do with scaliness or dryness or shedding. The blood vessels open up after they've been closed down by the steroids. Patients get red, and they make an abnormal outer layer, which becomes scaliness and shedding, and that episode is over with until the flare of the red blood vessels happens again and again and again. It is not a dermatitis where a lubricant is going to help at all. So please save your money. Vaseline works just as well as anything else, but it is not attacking the pathology that's operative here.
So when somebody gets out of the shower and say they've gone through recovery, but they are applying a Cetaphil or one of those types of things daily, is that something that has no benefit, is beneficial? Do you have an opinion on it either way?
Well, you have to realize that after somebody has been suffering for such a long time and applying lotions for years, taking aspirin for years, taking sleeping pills to get better sleep for years, it's very hard to break that addiction there too. They're addicted to the use of moisturizers. They like the feel. They think it's working. And as long as it doesn't cause harm, I say, don't worry. I don't want you to spend a lot of money. I don't want you to be talked into something that isn't really working. But all of these are totally unnecessary. When you get near the end of this process, when the redness is over with and the itching is really quite abated, but still there a little bit, maybe in the 4th year, I have patients go out into the sunshine. Sun is anti-itch. The kids in the 1920s and 30s and 40s were sent to the beach in the summertime. The wealthier people in New York sent their children to Arizona in the wintertime because they knew that the sun worked like a charm. Eczema went away. Itching went away. Simple therapy. Doesn't cost anything.
I'm begging for people who are watching this to send this video to their loved ones so that they can get a sense of explanation of what they're going through, because it is very wearing to constantly have to defend something that very few people know about. You know, alcoholism, okay, yeah, we all get that. It's a different animal.
I think I tried to find the worst possible word to explain the travail that these patients are going through, that they should not. and I hit upon the word suffering. To me, suffering implies the worst bottomless pit that they're in, because that's what they're in, and they cannot turn to anybody who will understand and hold their hand. They'll get lip service, they'll get pats on the back, but it's just your skin. Come on, there are worse problems in the world. So you're itching. They are miserable 24/7, and they're suffering 24/7. And once they know the diagnosis and they see there's a cure at the end, or at least I'm offering that, they brighten, because somebody understands, and there is an end. There's going to be a light at the end of the tunnel. This is curable, totally curable.
I had the privilege of being at the Impact Award, the Ethos Award, where your film was screened, and I was not aware that the other people that were in Skin on Fire movie were there, and I realized I'd never met anybody in person that had gone through topical steroid withdrawal, and there was a little bit of a break and a question answer period, and one of the people who were in the movie, who I'd never met before, came up to me and just gave me a hug. They didn't say their name. They didn't introduce themselves. They just gave me a hug. And I was thinking about that, and it's almost a silent admission that nobody can understand except another person, the depth of just how bad this is.
Then I must say, or my interpretation is that the word suffering is the glue that the opioid people have with each other, the amphetamine have with each other, the gambling addict has with each other, the eating disorder person has with each other, and the red skin syndrome, steroid addicted. The glue is we're all suffering. You're my comrade in this. I'm so happy for you, and I'm doing better also. I'm going to bond with you. I understand you.
The difference is all those things that you mentioned, there's a community. For topical steroid, you're never going to meet another person suffering from withdrawal. You're just not going to meet that person unless you're sitting in the waiting room of your office.
And you're right. And I think most of mankind is gentle with the opioid addict, with the alcoholic. We know they are going through hell. We know that they need help. I'm here to help you. We know that it's a difficult problem, and we know that most of them are not going to survive. So we're kind to them. In this situation, we're uncertain what this means, because we keep getting told it's bad eczema, you're going to have this the rest of your life, let's try this new drug, look at the new ads on the TV, et cetera, et cetera. Why don't you try that, find another doctor, go to the university. The same impetus, I think, has stopped with the alcoholic and with the opioid addict. We've almost given up that the answers have not been forthcoming in 50 years or 100 years or more. And we're not as sanguine about the results anymore.
This person writes, and it's very heartfelt, and you can feel her pain. She says, I'm 3 years, 3 months in and still trying to stay positive. I've been using steroids since I was 5. I'm 32 now. So I expect to be more of a long hauler, but my goodness, I also would have expected to not still have intense flare-ups after all this time. I know I would never go near a steroid for as long as I live, but my morale is definitely lower than I'd like.
You know, I don't understand why many people who have written here, have written to me. I'm sure I have answered 10,000 requests for information and answers. Why they don't seek more medical care? Have they been so turned off? Have the doctors been that miserable to them? They've gaslit them that badly that they refuse to seek out care? Some go to alternative medicine, which I don't especially agree with. They go to acupuncturists, to gurus, to all kinds of exercise regimens, et cetera, which are totally valueless. Have they soured on the medical community? And have we fostered that souring? We set that up. I'm angry at my colleagues. Very angry.
That's quite a statement.
I don't know how to change them. I've tried everything. I've written, I won't go into it, 9 peer-reviewed papers that have been published. I have lectured. I have done everything. Tried with the movie. This thing that we're doing, I'm having fun. Your questioning is wonderful. It's talking. I think people need to be talked to, not just read something. I hope that this might be the answer. And as you said, the dent in the armor has come with these TV ads for all the new drugs. They all say, we don't have steroids. And your comment is very sagacious. They have picked up on that. They don't say why they use that line in their ad. Why don't you say, why are you saying that? Is it an evil preparation? Were patients addicted? Oh, you won't use that word addiction? But your drug is good. Please spend $60,000. Why are you using that word? So we've made a little inroad, but I'm sure that patients have no idea. They're not questioning why the word is being used.
And I think that's part of the intent of this video series is for the sufferer or the loved one is really kind of in the room with us having this conversation, an ongoing dialogue about their condition and how they're feeling and what's happening in the overall community.
When I was in training and the way I've looked upon medicine, the psychotherapeutic part of every disease is vast. And that's the hugest part, I think, of what we do. Yes, we have good drugs, we have good surgeries, we have good medicaments, we have lots of good things, but a lot of it is getting the patient through the horrors of what they're suffering. They can suffer with a cold, they can suffer with cancer. They're still suffering and they need us. And the doctor who doesn't undertake that part of the therapy is failing in his job.
We saw a note from a mom who has a baby who applied topical steroids for 10 days and now is feeling that baby is in full-blown TSW. Is that even possible?
Well, you must, like, through this whole discussion now, you must get the specifics, because in the minds of most patients, TSA, TSW, whatever, is absolute, and this is what I'm showing is the only pattern. It's not true. This mother applied the steroids to the face. It's death putting steroids on the face of a young, little 3-month-old or 4-month-old. It's absorbed instantly. The vessels overreact within 2 days, and the addiction sets in very quickly. And 10 days sounds ridiculous, but I'm sure I could apply the word addiction. If they're spreading it and they needed more and they couldn't calm the rash down, the kid's addicted. But it's the facial exposure. That's murder, and that should be totally avoided. And even if it's weak, the vessels still respond. And if it's weak, the rash doesn't go away, so they keep putting more and more on. How many times did they apply in 10 days? Who knows?
Have you seen instances for adults where topical steroids were applied to the face where facial hair may not regrow?
Well, I have to see the picture. My suspicion is, I saw that comment also. My suspicion is that this man had alopecia areata, which is part of the diagnosis of eczema, one of the asides, just like itching is an aside of atopic dermatitis. And he just manifested the loss of hair in circles on his bearded area as well as he could have on his scalp. Nothing to do with the steroids. But that's what I think is going on. The women, not the men, a pretty good percentage, maybe 20, 30%, who are steroid addicted and go through withdrawal, the women lose frontal hair, frontal loss temporarily, and it all regrows. The men don't lose hair. There's something about the hormonal aspect of steroids being closely related to the male-ish hormone progesterone, which makes women lose hair. I don't know the mechanism, but it's obvious, and the women panic, and I reassure, it'll all grow back.
We had a woman that commented that she was oozing from her nipple in the midst of her withdrawal. What is that?
Well, I think there are loaded areas anatomically, and the way patients look upon their bodies can be peculiar and different. I think the breast is a loaded area, and anything that occurs in the breast in the unbeknownst person or the frantic person implies severe worrisome disease, like maybe even cancer, which is inappropriate. The nipples can get itchy in the atopic and the eczema person. It's called jogger's itch. They run the ladies in little halter tops, and the rubbing during the jogging makes the breasts get irritated, and they get red and irritated, and they start putting steroids on in that location. No, nothing to worry about. It's just another location on the body that got irritated, probably from clothing. And they get addicted very quickly there. And the ooze is part of the addiction.
Edema during the withdrawal process seems to be almost a given. What are your thoughts on treating edema in the ankles and the knees?
Well, the pathophysiology should be understood, how easy it is. You mentioned oozing just 2 sentences ago. That's fluid being poured out of the skin from the dilated blood vessels. Edema is fluid being poured into the depths of the skin from dilated blood vessels. Independent areas, so if you're up all day working or whatever, and you're still in the beginnings of withdrawal, the fluid will collect in your ankles. If you're sleeping and you had applied a lot of creams to your face as you're lying down, when you wake up in the morning, your face is puffy, you got swollen eyelids, edema there. This will go away. It's at the beginning of the withdrawal process. Often I will suggest to allay concerns that we do have diuretics if needed, but I have only very rarely resorted to that. Maybe when both legs are swollen up above the knees and the patient can't walk well. Usually a little bit of time, a little elevation, a little warm compresses, a little bathing, a little off the feet solves the problem with no more drugs.
Are you okay with some of the over-the-counter diuretics?
They're valueless, probably. They don't do anything. And again, here we're talking about a drug problem, a medication problem. Everybody in America loves taking medications. That's our mantra. We love the medicine man who came up in the covered wagon in the 1800s. What kind of elixir do you have, sir? This works for arthritis, alcoholism, headaches, migraines, swollen ankles, hangnails. I'll take 2 bottles, please. That's who we are. That's our nature. And most things are valueless.
You mentioned oozing. First of all, what is that ooze? And it does have an odor, correct?
Well, the ooze, usually the patient has little tiny blisters, water blisters, when the steroid vessels are dilated and they're pouring the fluid out. It's not herpes. Those are little blisters from steroids, not herpes. We've gone through that last time. The smell of oozing is propagated by many areas. I'm not whizzing totally on it, but it can be bacteria on the skin mixed with sweat, which can give a certain odor in some people. It can be certain things that are ingested. Heavy metals like lead and arsenic can give a certain odor, et cetera, et cetera, et cetera. But it is not evil. It might be not pleasant, but this will stop with the sweating process abating and the oozing abating.
Have you seen a correlation between a flare and a woman's cycle? Is there any indication at all that there is a relationship?
I've pondered and been concerned and have instructed a couple women through the years. I've pondered the idea that progesterone estrogen chemical moieties, the chemical structure, is very closely related to the chemical structure of cortisone. That if indeed they're on the pill, if indeed they're on postmenopausal hormones, could it be perpetuating the problem? I think I have verbalized, rarely, but to some people, if something is unnecessary, stop it. I never said that I think it's worsening your red skin. It's just another drug that you don't need to take. Maybe you should reconsider the birth control pill after 5 years to stop. I don't like the breast being exposed. Maybe Mrs. Postmenopausal, are you really getting value out of this, or is this all drug company hype? Which is exactly what it is, drug company hype. It doesn't make your sexuality better. It doesn't make the vaginal vault less irritable or less itchy, et cetera, et cetera, et cetera. It's all in the domain of hype from the drug companies. Valueless. If God wanted you to not stop menses, he would have continued hormones. You don't need them.
So this is the third of these interviews that we've done. And when we go on YouTube and we put in your name, now the first two interviews come up as number 1 or number 2, especially with topical steroid withdrawal. That's the result of you, the viewer, hitting the like button. So we would respectfully request that you like this video. Even if you don't like it, we would respectfully request that you hit the like button so it does show up on the algorithm, so people who need to see this and be reassured by this information do indeed get to see it.
That's our only thing that simulates the drug company. The only advertisement we'll ever do, just to make you better. We're not selling anything.
I like that. And it's interesting. It's not by design, but this is our third video and we're almost at 45 minutes and it's not planned. I wanted to leave you with this comment. This person's thanking you. Thank you, Dr. Rapaport. This is the morale boost I needed after having a complete mental and emotional breakdown today. 5 years of topical steroid withdrawal, and I feel like I've got to be nearing the end of this. Your words are my hope.
Well, I'm complimented, but I feel so sad that all I got to do is talk to this person on the phone or see them in person, and we'll recapture those 5 years of lost days with a person-to-person. You can't do this alone. You're tough, you're a trooper, madam, but I wish you would seek out help and have somebody hold your hand and get you through a better day than a bad day today.
Fantastic. Well, we'll continue to do these, and you're available on Facebook, and people can reach out to you.
Yeah. Will this be up again within a couple days?
Yeah, it'll be up.
Okay, great. All right. And hopefully we'll get more replies.
Okay. Thank you very much. I appreciate your time. And thank you, Lupa.
Thank you, Lupa.